Hi. Okay. The bird is screaming. Hey, Zach, can you get the bird, please? All right. I have a screaming bird. I think I figured the lighting out since last time too. I'll wait a couple minutes so people can get on. All right. Um, Zachary, please. Okay. All right, let's get started. So, I'm going to be talking about chiropractic and how it works, and why everyone should get adjusted, and everyone's child should get adjusted, and why you should get adjusted for the rest of your life. It is one of the, if not the most important things that you can do for your health, getting adjusted. And I'm going to also show you guys x-rays, because I take x-rays to see like exactly what kind of adjustments you need and what kind of exercises you need. Hold on, I'm going to ask him one more time to get the bird. Hold on. Hey, Zach, honey. Zach, honey, I'm doing a video live. It's on right now. Can you please get the bird? Please? Come down and get the bird. He hasn't stopped screaming. And I'm doing a live video. Please. Now, please. He's in his cage. Please come get him from his cage. I'm on live right now. All right, so I'm hoping that Zachary comes down and gets his bird. Okay, so I'm going to have to talk to you first about how chiropractic is different from medicine, because that's how you're going to understand it's a different way of looking at health. So in the medical system, they look at your symptoms, and they say, okay, here are your symptoms. I'm going to give you a diagnosis based on your symptoms, and then you're going to get medication for it. And how long do you have to take that medication for? Forever. Almost many times forever. If you have high blood pressure, you have a thyroid issue, autoimmune disease, high cholesterol, diabetes, you have to take that medication forever, because that medication isn't fixing the problem. It's not fixing your body. It's not curing you. It is managing your symptom. And so that system, the medical system, is not really health care. It's disease management care. That's what the medical system is. It's disease management care. You get a diagnosis, get a pill, and that's it. And it's not looking at your body the same way. So as a chiropractor, we say, you come in with symptoms, and we say, okay, you have these symptoms. Why do you have these symptoms? What in your body, what's going on in your body, what's not working properly, causing those symptoms? If you have a high blood pressure and you go to the doctor, they will give you a medication. If you have high blood pressure, come to our office. Sometimes you need to stay on the medication while we fix the underlying problem. So we look at what you're eating. Of course, we look at exercise, we look at those things, but we have to look at, why is your heart not functioning properly? What is going on there? When you have diabetes, it's the same thing. You can reverse diabetes. The doctors will say, oh, you have diabetes, that's it. There's nothing you could do. Here's insulin, here's metformin, whatever, take it forever. But we want to reverse diabetes. And so we have to look at your body and say, what is going on that's causing these symptoms to happen, so that we can fix the cause. We find the cause and we fix the cause. And that's how you reverse diabetes. That's how you reverse heart disease. That's how you reverse any kind of autoimmune disease, by finding out what's going wrong in your body and then fixing that. We don't want to manage a symptom. We want to manage your health. We want to get your body healthy so you don't have this symptom. Does that make sense? I know it's a very, very opposite way of looking at the body. You're going to be taking a lot more personal responsibility, instead of just, here's a pill and do whatever you want, right? Here's a pill, take this pill and just whatever. So now if you have a high blood pressure and you take the pill to lower the blood pressure. It doesn't fix it, obviously, because you have to take the pill every single day forever. What happens if you stop taking the pill is that, you still have high blood pressure. It just comes right back up. So nothing has changed. So if you have something wrong with your heart, if your heart isn't functioning properly, then your brain will tell your heart to pump harder. So maybe you aren't, one of the things that the heart does, the main things, it just brings blood and oxygen to your organs and to your brain. So if your organs and your brain are not getting enough oxygen or blood, your heart will have to pump harder to get more blood and oxygen. So why? What's interfering with enough oxygen or blood? What's interfering? So your body, what's interfering with that? Why does your heart have to pump harder to get the proper amount of oxygen and blood? So we have to keep looking deeper and deeper and deeper into your body to figure out what is causing these problems. So high blood pressure. So a lot of patients come in with high blood pressure and they don't want to be on their blood pressure medication. They want to reverse the problem. They want to fix the problem. So we say, okay, we look at what they're eating, of course, like get off sugar, reduce processed food. But number one, we have to look at the system in your body that tells your heart what to do. If your heart isn't working properly, it's not working properly because most of the time, it's not getting the proper information from your brain. So how does your body work? Your brain tells your body what to do. Your brain sends signals through your spinal cord, out your nerve, to your heart, and tells your heart what to do. That's how your heart works. That's how all your organs work. We're just going to focus a little bit on the heart. So your brain sends information through your spinal cord, out your nerve, to your heart, and tells your heart what to do. It tells all your organs what to do, but that's how your heart knows what to do. Now, if I cut the nerve to the heart, your heart is going to stop. It's not going to function at all, correct? Without your brain telling your heart what to do, your heart is not going to be able to function at all. So if I cut the nerve to the heart, it stops functioning. If I cut your spinal cord anywhere above where the information leaves and goes to your heart is going to stop functioning, right? Now, so when someone gets paralyzed, they have like a cutting or a slicing of the spinal cord. That will shut down all your organs, right? Including your heart, depending on where it happens in your spinal cord. But what if you squeeze the spinal cord? Squeeze it. Or what if you pinch the nerve? What if you squeeze the nerve? If you squeeze the nerve or squeeze the spinal cord, not all the information is going to get from the brain to the heart. The heart is not going to have the information it needs to function properly, and it's not going to function properly. And so no matter what medication you take, no matter what you put in your body, no matter what supplements you take, if that information is cut off from the brain to the heart, your heart is just not going to work. Now, if I cut the nerve to the heart, your heart, it dies. It just shuts down. But if I squeeze the nerve to the heart, your heart slowly, slowly, slowly degenerates, slowly, slowly, slowly dies. And no matter what you do, no matter what medication you take, no matter what you do, if that pressure is on that nerve, your heart is not getting the information it needs. It's slowly dying. Here's your heart slowly dying. You can take medication and it looks like you don't have high blood pressure, but your heart is still slowly dying. Medication has zero effect on that. So your heart is slowly dying, slowly dying, slowly dying. The only thing that you can do to fix that, to stop that from happening, is to take the pressure off the nerve, to take the pressure off the spinal cord, so your brain can send the proper information through your spinal cord, out your nerve, to your heart. The proper information gets to your heart will start functioning again. So if you have, it's an easy way to look at it is if you're watering the flowers and you have the hose set up and you turn the water on and say the flowers need 15 minutes of water to get all the water they need so that they can grow properly. Now, if you put a big rock on the hose and it cuts off, say, 5, 10, 15, 20% of that, 50% of that water, and it's on for 15 minutes still, that is lowering the amount of water going to the flowers, going to the plants. If the plants don't get enough water, they're not going to flourish. They're not going to be able to live properly. They're going to slowly, slowly, slowly die. So what do you see happening? You'll see bugs on the flowers. Like, why do my flowers have bugs? And then you spray the bugs, and then the bugs come back, right? You spray the bugs and the bugs come back because the bugs aren't the problem. The flowers not getting enough water is the underlying problem. You give those flowers enough water, it strengthens them, and the bugs aren't going to be able to attack them because they're not weak. It's the same thing with your body. If you cut off the information, 5, 10, 15, 20%, 50% of information to an organ, to your heart, the heart is not going to be able to function properly. It's going to slowly die. Maybe your heart will then not work properly. Maybe you'll have high blood pressure. Maybe you have low blood pressure. I don't know what's going to happen. All I know is that your heart's not getting the right information, and it's slowly dying. And so as a chiropractor, I take an x-ray of your spine, and I'm going to show you x-rays soon. I take an x-ray of your spine to see where is the pressure. Are there bones pressing the nerves? Are there bones pressing and squeezing the spinal cord? And if there are, you get an adjustment. The adjustment takes the pressure off the nerves and off the spinal cord so that the information from the brain can travel directly and go where it needs to go, to your heart and other organs. It's like the adjustment is like taking the rock off the hose so the flowers get enough water. That's the adjustment. You're removing interference. I'm not healing you when I adjust you. Nobody heals you. Nothing heals you. Medicine doesn't heal you. A good diet doesn't heal you. Exercise doesn't heal you. Supplements don't heal you. We remove interference. So an adjustment removes interference so the brain can communicate with the organs so the organs get the information they need, right? A good diet doesn't heal you, but when you stop putting poison, when you're eating a good diet, you're not eating poison. You're not putting processed junk food into your body. Processed junk food destroys your body. Eating a good diet removes the processed junk food so your body has what it needs so it can work and function properly, right? A supplement doesn't heal you. If I give you a supplement and it helps you, say magnesium, everyone is deficient in magnesium. It's just not in our food supply anymore. So if I give you magnesium, if you take magnesium and all of a sudden you start sleeping better and your muscle tone is better and you go to the bathroom better, it's not that the magnesium fixed those things. It's that your body was deficient in magnesium and it needed it. So you take the magnesium so your body can work properly. It's all about giving your body what your body needs so your body can work properly and removing the things that are interfering with your body functioning. So sugar doesn't give you anything. Rice doesn't give you anything, but it just interferes with normal function, right? Does that make sense? Vitamin D, your body needs vitamin D, and you get that from the sun. And so when you get that vitamin D, your body's able to perform the functions it needs to perform, create the hormones it needs to create. You're giving your body what your body needs. And then you're removing things that interfere. So bones on a nerve interferes with the function of your body. That's the number one thing that interferes with your body functioning properly is bones squeezing, pushing on a nerve or on your spinal cord. That's the number one thing that interferes. You get that adjustment. There's nothing more important than getting that adjustment to take that pressure off your spinal cord and off your nerves. Allows your body to start functioning, allows your brain to communicate with your organs, and everything can start to function and heal. Now, when you come in, if you come in with a certain health issue that we want to find the cause and fix, you start with the adjustment. And then you may need to change your diet because you're doing things that are interfering with your body healing. You may need to get rid of toxic chemicals, get rid of sugar, and we want to wean you off medication as you don't need it anymore. When someone comes in with high blood pressure, as we were talking about before, we monitor. So once you start getting adjusted and you take the pressure off the nerve going to the heart, you have to monitor your blood pressure because your blood pressure will start to get lower and lower and lower. So we have to monitor your blood pressure. As your blood pressure gets lower, you have to take less blood pressure medication to keep your blood pressure normal. Like if your blood pressure is getting lower and you're still taking blood pressure lowering medication, it's going to be too low. So as your blood pressure gets lower naturally, you take less medication and you slowly wean off the medication. Do it with your doctor so that it keeps your blood pressure even, so that by the end, or I don't know, sometimes a few weeks in, sometimes a month or two in, you have normal blood pressure that's basically the same as you were on medication, but now you're not on medication anymore. And that's the goal, because the medication interferes and destroys your body. It destroys your organs, it destroys your body, and it's allowing your body to not function. And it's like putting a piece of masking tape over your oil light and saying, oh, there's nothing wrong with my engine. The oil light comes on, put a piece of duct tape over that. You don't see the oil light. There's still a problem. The medication is covering that up, is masking, is duct tape. It's covering up the problem. You want to know what the problem is. You want to fix the problem and not need the medication. That is the entire goal of what I do, is to fix your body so that you don't need medication anymore. Now, once in a while, like I said, you might need to take blood pressure medication at the beginning because if your blood pressure is 200 over 150, you can't stop taking it. You'll have a heart attack. So you use the medication as in an emergency situation. That's what medicine is amazing at, is emergency. So you use the medication, but then as we start to fix your heart, get adjusted, change your diet, you slowly wean off that medication. Now, I have patients that come in before going to the doctor because when they go to the doctor, they get nervous, their blood pressure shoots up, and then the doctor thinks I have high blood pressure. So I have patients that come in right before a doctor's appointment because it lowers and calms down their blood pressure. It slows down their heart rate to a nice normal level. So when they go to the doctor's not freaking out about their blood pressure, right? So that's just one thing that I see. It's interesting. People come in regularly, their blood pressure is always like, their blood pressure normalizes, they get off medications, come in a couple of times a month, once a month, depending on the person. But then they have something happen and like, I'm nervous, I'm going to the doctor. And when they get nervous, their blood pressure gets a little higher because that's normal. That's what your body does. So they come in, get adjusted, lowers it down. So when they go to the doctor doesn't give them a hard time about not being on their medication anymore. Right? So, but you have to start looking at your body this way. You have to start realizing that your body is designed perfectly to work perfectly in every way. We just interfere with that, right? We sit and look down at our phones and squeeze our spinal cord and compress our nerves, right? We eat processed junk food. We do all these things to interfere. You have to start taking care of your body so that your body is healthy. Kind of like with this COVID thing. If you have a healthy functioning immune system, you're not going to get the virus. Or if you do get it, you either have no symptoms or very little symptoms. Your body just fights it off. But if you have a very weak, compromised immune system and you're on multiple medications, your body's not going to be able to handle it, right? So it's always about getting your body healthy, always about getting your body healthy. That is the number one thing that I do as a chiropractor, is get your body functioning as close to 100% as we can, so that you have health, so that you could do whatever you want, so that you go to sleep, so that you wake up without coffee and you go to the bathroom without laxatives and you fall asleep without medication and your heart functions without a medication and you don't have diabetes anymore because your pancreas and your endocrine system is functioning. Your body is amazing ability. God put such an amazing power in your body that made your body and that heals your body. And everything that happens, there's a reason. When you have a fever, it's not like, oh no, there's a fever. It's like, oh, of course there's a fever. A bacteria attacked me or a virus attacked me. My brain told my body to increase the temperature to kill the virus or the bacteria. That's why you have that. You have to start looking at your body in a different way. You have to stop looking at symptoms and looking at cause. Anytime someone comes in and say, I have this, and this symptom, we have to immediately start saying, why do you have those symptoms? Not like, what's your diagnosis? It doesn't matter. It doesn't matter what your diagnosis is. But why would that matter? Why do you have that symptom? Why do you have high blood sugar? Why do you have high blood pressure? Why do you have constipation? Why can't you sleep? Why can't you breathe at night? Why are your thyroid levels off? Why do you have anxiety? Why do you have depression? Why do you have pain? Why do you have headaches? Why do you have these things? Let's look at the body and say, why is this happening? And so I mentioned earlier, like I look at x-rays. And now the reason, here's an x-ray. I hope you can see that. I'll make it a little bit bigger. So here's an x-ray. So there's the teeth, there's the back of the head. I'm not a very good tech person. So I'm sure there was a way to make this larger, and I don't know how to do it. But if you can see that, you can see that there's a nice curve. Here's your teeth. There's a nice curve in your spine. Your spine is, I should have brought my spine home from the office. I forgot. But your spine has a nice 45-degree curve from the sides. That's what you're supposed to look like. You're supposed to have, can you see it? A curve from the side of your neck, curve. Your back. Here. You see that curve? 45, that's a 45-degree curve. You're supposed to have curves in your spine from the side. Your neck, your lower back, and your middle back, and your lower back. Here, I'll make that larger again. So that, here, I'll make it really large. So that is the curve, the normal curve that you're supposed to have in your spine. When you have that curve in your spine, 45-degree curve, that is the strongest curve that exists in nature, according to mechanical engineers, is 45-degree curve. Because when you have that curve and something falls in your head, your whole spine bounces, right? It takes it's like a spring. It takes the pressure. If you lose that curve, there's nothing to take the pressure. You could fracture a bone. So it protects you. It protects you from trauma. That's why we have those curves. We develop those curves when we crawl as babies. The baby's born like a C, and then it crawls head and butt up, and you develop those curves. Now, your spinal cord is that shape. The shape that's here, this is the shape of your spinal cord. It's that shape. So when you have that curve, there's no pressure on your spinal cord. There's not going to be pressure. So when I take an x-ray, I'm taking an x-ray to see, do you have that curve? And if you don't, my job is to get that curve back as close to normal as I can. That is my job as a chiropractor. And as you take the pressure off the spinal cord when you get adjusted, your body starts to function better. Now let me show you another. I'm going to have to click off here. Let me show you another x-ray. Hold on. Really? All right. I think this is going to be easier for you to see. I'm going to pull it up real. So here, I'm going to make it as large as I can. So here, oh man, here the one on the left. I don't know, the one that's the one that's straight. Can you see the first one? The second one, the one to my right. I'm not sure how if you're seeing it as a mirror image, but the curvy one is the same one I just showed you. It's normal. The one to the left of that, to my left of that, is straight. You can see that that is straight. There's no curve there, right? That is what I see. That is mostly what I see when people come in. They don't have that curve. Their neck is straight. Why is their neck straight? Because they sit on the computer all day. They look at their phone all day. And that normal curve is just slowly over time straightened out, straightened out, straightened out, straightened out. Now your spinal cord that sits inside of there is being just pinched, and squeezed inside of those bones. And your body is not going to function. That's going to cut off the flow of life from your brain to your organs. And so it's real easy to see the difference there. One's curved and one isn't. So when I see that, I give you very specific adjustments and exercises to do. The exercises you do at home, you do exercises at the office, but the goal is to put the curve back. Because when the curve comes back, the pressure comes off. And when the pressure comes off, the brain can communicate with the organs and your body can start to function. That's it. That's how your body works. That's what chiropractic does. Now, as I adjust your spine, now this goes for your lower back too. I don't have low back x-rays to show. The neck is most important, but it's the same thing. It's either curved or it's straight or somewhere in between, or sometimes it's forward and bending the wrong way. When you don't have a curve in your neck or your back, or maybe you have a scoliosis, I'll talk about that after, but if you don't have a curve, that could cause pain. So yes, if you come in with back pain or neck pain, your pain will go away, but the pain is not what I'm trying to treat. That's not the goal of treatment, is to fix your pain. The goal of treatment is to get your body functioning, so your body works the way it's supposed to. So you have strong functioning organs, strong systems, strong immune system, strong reproductive system, strong cardiovascular system, strong endocrine system. Your body is functioning the way it's supposed to. But as a side effect, the straight spine will have pain and the curve won't. Great, we'll fix your pain. My job is not to fix your pain, though. That is a side effect of getting better. Does that make sense? Because that's just not how I practice. That's just not what I do. Here, let's look at some other x-rays. All right, so now I'm going to put it all. You can see the same one, the curve is the same one that I showed before. That's the same normal. And the other one, can you see that that spine is curving the other way? The other one was straight. This one is going forward. See how it's going the other way? It's curving. I can't do this. It's curving this way. See that? See that curve? It's going the other way. So instead of having a spine that's doing this, I see people now with spines going the complete opposite way because of how much they put their head down, how much they look at their phone, how much they look at their computer. Now, that patient, that one that has the curve going the wrong way, she came in and she had a migraine headache for 4 years. She had a headache if she was awake, she had a headache. If she was awake, she had a headache. She popped ibuprofen or Tylenol, whatever it was, all day, every day, just so she could function. Clearly, she did that for 3 to 5 years. Clearly, that didn't fix it. It doesn't fix it. In fact, it makes it worse when you do that. You don't want to manage that with a pill because your body gets used to taking that, and then you get a headache if you don't take the ibuprofen or the aspirin or the Tylenol. It's not fixing anything, and it's damaging your organs when you take over-the-counter medication. It will damage your organs. It will damage your liver, it will damage your kidneys, and it will damage your colon. So she had a headache all the time. She was 25. She was depressed. She was diagnosed bipolar, and she was anorexic. So I started adjusting her spine. That was her spine, the one that was going the wrong way. I said, well, that's great news, Emily, because I know what's causing your headaches. So I started adjusting her, and within 3 weeks, her headaches went away. They were gone. They were gone. She had no more headaches. And after about 24 to 30 visits, I take new x-rays to see how much her spine has improved and what treatment you need going forward. And so once her headaches went away, I said, well, it's time to wean you off your antidepressants. She's like, well, the doctor told me that I have a chemical imbalance in my brain and that's why I'm depressed. I said, okay, contact your doctor. I want to see the test results that he did. What tests did he do? What chemicals in your brain are out of balance? I want to see that and see if there's something natural we can do, whatever. So she comes back in the next day. Yes, I will, Barb, I'll tell you in 1 second. Emily comes back in the next day or 2 days later. She's like, well, my doctor didn't take any tests. How does he know I have a chemical imbalance? I said, well, he doesn't. That's just something that people say that, well, you probably have a chemical imbalance because you're depressed. Why do you think Emily was depressed? Because she had a headache all the time. Do you understand that that's depressing? That is hard. That is hard to wake up in pain. It's hard to wake up and your body's not functioning. That's depressing. And so when you fix that, you have to only realize there's nothing wrong with you for being depressed when you have your body not working. There's nothing wrong with you. You're depressed. It's hard. It's exhausting. Pain is exhausting and it's depressing. And so when she understood that, we slowly weaned her off her antidepressants. It took about 2 months to wean her off her antidepressants. Within 6 months, her psychiatrist said she was no longer bipolar and weaned her off those medication. And within about a year, she was not anorexic anymore. One of the things that was causing her anorexia was all of this aspirin or ibuprofen she was taking that was messing up her stomach, and it hurt to eat, so she just didn't want to eat. That was her anorexic experience. There was many other experiences that people have or reasons why people have anorexia. That was hers. And when she realized and her gut started to heal and her stomach started to heal, she started to eat and realized that she didn't have pain. So she was able to eat more and more and more. And then within a year, she was better. And that is the whole point of everything I do. Somebody just asked, can you adjust people with severe osteoporosis? I definitely adjust people with severe osteoporosis. And I don't use manual adjusting necessarily. I don't do anything like that. Sometimes I do, depending on your osteoporosis. I have a tool that I use. And with osteoporosis, it's really important to get that curve back so you don't also have degenerative arthritis. So I do gentle adjusting with like this arthrostim that I have. We do a lot of adjustment, a lot of exercises, and there's a lot of nutrients that you can take that you don't realize that you can take to reverse osteoporosis. I do have I did a class a few months ago, Barbara, and it's on Facebook and it's on YouTube, and it's about reversing osteoporosis and what causes it, and lots of micronutrient deficiency many times, and there's things that you can eat. There's ways to eat, there's supplements you can take, there's things that you can do. After people get adjusted at my office, we do a vibrating platform. I'll explain that exactly what that does in a minute. But vibrating platform, vibration helps rebuild bone also. It helps your bone take in calcium from your blood. So there's a lot of things. There's a lot that you can do for honestly for anything. There's a lot you can do. Your body has an amazing ability to function and heal. Amazing. Don't ever doubt that. It's just amazing. I've been doing this for 28 years and I've seen everything. I've seen everything get better. I've seen everything. Here, let's look at another x-ray. Hold on one second. I'm just waiting for it to load. All right. So here's another thing I see. I'll put it full screen. Look look at that. That one is completely forward. You see how that's like all leaning forward? So that's like, Emily was like this. This person's like this. And again, that is what I see very, very often because people are on their, if I'm doing, leaning forward on their screens or leaning forward looking at their phone, right? They're looking at their phone or on their screens and they lose that curve and it goes forward. Same thing. That's why I take x-rays because that person needs a different adjustment and different exercises than the other person. And everything I do, or the way I treat, the exercises I do, everything is based on objective findings. What do I find on your x-ray? And then I re-x-ray to make sure that things are improving, that the exercises are working. And what do you look like now? What do you look like in 2 months? Let's check what you look like and let's reevaluate your adjustments and your exercises. So when you come into the office, it's very, very different. So it's very different for a lot of reasons. But one of the reasons is I do corrective care, which means I look at your x-ray in order to correct it. So corrective care involves working with the muscles and along with the bone. So like with your teeth, like when you have braces put on, you put the braces on, sometimes they're on for 2 years. You take the braces off, and if you don't do anything else, your teeth are going to slowly be pulled back to where they were, muscle memory, right? If anyone who on here who's had braces, you wear a retainer at night to like keep it so your body, your muscles don't pull it back. I had braces when I was like, I don't remember, maybe my mom's watching, 13, 14, something like that, 15 maybe. And I wore the retainer for a while, but I kind of stopped wearing the retainer. And guess what happened? My stupid teeth started go back to where they were. So the retainer didn't fit me anymore. So then when I was 30, I got braces again because it goes back. If you get an adjustment and you don't do anything after the adjustment as a retainer, your muscle memory over the 4 to 5 hours after your adjustment is going to pull you back to exactly where you were before. So you'll get an adjustment, which is great. That's fantastic. It's great for your immune system. It boosts your immune system. It does great things. But it's not, the adjustment itself is not going to, it's not going to correct the spine necessarily. You have to set the adjustment. So when you come into the office, you'll see people on these chairs wobbling, doing these exercises. We want to warm up your spine, your discs, your ligaments, your tendons, and your muscles so that when I adjust you, I'm not fighting with a cold, tight muscle or ligament or disc, right? Or tendon. And then you get a better, more effective adjustment because you just did active rehabilitation and warmed everything up and brought blood to areas that normally isn't there. So now you're warm, you get a much more effective adjustment. After your adjustment, you stand on a platform that vibrates with a weight on your head. The vibration stimulates your cerebellum, which is in charge of posture, and then the weight puts you like this. I have one upstairs, I should get it. But you put a weight on your head and you do this and you're standing there like this. And now your body, so your weight holds you here and the vibration tells your cerebellum that this is where you were, not here. So it sets that adjustment so that when you come in, maybe you're here, and then at your first adjustment, maybe you're like this. But if you don't do the head weights, you go right back to here. And then we just do this for years. This is it. You move it, it goes back. You move it, goes back. But if you set it, next time, then you move it, set it, set it, set it, set it, like, and then that's how you fix that. And then you get exercise based on your x-rays, you get exercises that you do at home so that you're doing more to correct your spine so you have a healthy functioning body. It's all about having a healthy functioning body. It's all about taking pressure off your spinal cord so that your brain communicates with your body as quickly as you can. So that if there's anything, like maybe if there's an organ not getting enough information that's about to have a disease or whatever it is, it's just going to shut down. We take that pressure off and get that brain communicating with that organ as quickly as we can. And that involves rehab at the office. It involves exercises at home. They're not hard. They're very simple. I have videos on my website, but you can't just go do the videos. You have to come in and get x-rayed because they're very specific exercises for basically for what I see in your spine. And so I see people, I treat babies when they're born. My children were treated when they were an hour old, like a little tapping on their spine, a little jiggling of their atlas and their spine. They don't need adjustments because there's not a lot of muscle to take the pressure off from the trauma, from the birth trauma. So my children have been getting adjusted since the day they're born. I have a lot of patients I see, a lot of children that I see, babies. And then I have children that I see that come in who are autistic, who we can do a lot to reverse. I have kids with ADHD, kids with kidney disorders, kids with asthma, a lot of kids with anxiety and depression. And it's all about getting their nervous system functioning so the bodies can function so they can heal. And I've seen everything in 28 years. Name something, I've seen it improve. I've seen it get better. I once had a little girl who was a year and a half that had kidney damage. Like the doctor said she was born with some kidney issue. But the adjustments, her kidneys healed. I don't know, I didn't heal her. I take the pressure off the spinal cord, the power that made your body, that power in your brain that made your body, goes to the organs and heals your body. The power that made your body heals your body only. That power in your brain that made your body, that runs your body, is the only thing that can heal your body. You remove interference so that power gets to those organs and those organs can work the way they're supposed to. Taking the kink out of the hose, all of those things. It's letting it flow. Power, I say when someone gets adjusted, I say your power is on because we just took the kink out of the hose and it's just like this rush of like information from the brain to the organs. And those organs are going to heal. They're going to function. They're going to work the way they're supposed to. It's amazing. Your body is amazing. And then again, I look at, okay, what are you eating? Like, are you interfering with food? Are you putting a bunch of junk in so your body can't function? Are you putting a bunch of toxins in, like interfering? It's all about removing interference. That's all it's about, so I could talk about testimonials all night. Does anybody have any questions? Oh, look at that. Okay, there might be one more. There might be one more X-ray. Let me see. I don't know. I don't think there is. I think that was it. All right. That was it for the X-ray. So, all right. So you come in. We take a history. We find out what are your symptoms, and then we take an X-ray. And then immediately I'm thinking, what's causing your symptoms? No matter what you have, no matter what diagnosis you have, no matter what you have going on. I've seen people who've had surgery on their back and their neck still get adjusted and still get better. We look at what your symptoms are. We say, what are causing these symptoms? And we start fixing your body. Because we're designed to live 100, 120 years and healthy. You should feel amazing. You should wake up. You shouldn't even need coffee. You should have a fully functioning day, do whatever you want, have enough energy to do anything that you want. You shouldn't be thinking about headaches and stomach aches and this and that and all these problems. It takes over and consumes your life. You shouldn't have to think about that. When you have health, you have a healthy functioning body. Once in a while you get a headache, once in a while you have a stomach ache, right? But if it's something that's chronic and daily, that's not normal. Tingling in your fingers, not normal. People think that's, oh, I have tingling in my fingers. The same nerves from your neck that go down to your hands to your fingers go to your heart. Tingling fingers is a sign that you have pressure on the nerves and you could have to be developing heart problems. You never want to wait for something to go wrong in your body to take care of your body. You always want to prevent. You always want to say, let me take care of my spine. Let me take care of my body. Let me put the right food in, minimize the bad stuff, try to get rid of chemicals, exercise, do all the right things so you have a functioning, healthy body because you're supposed to feel amazing all the time. You should have energy to be happy and feel amazing, like, right, not all the time, not 100% of the time, right? You have ups and downs, but your body should be working the way it's supposed to. You shouldn't need a medication to go to the bathroom, to sleep. You shouldn't need a medication for your heart to function. You shouldn't need a medication to digest your food or to have normal blood sugar. That's not normal. That's not good. You can't possibly feel good when you need a medication for those things, right? And so I'm 52. I don't take any medications. I feel amazing. I practice what I preach. I do all of these things so I know what works. I know what doesn't work. I know how to make changes. I know that this works. This is amazing. And any other questions? Not a lot of questions tonight. Anyway, if you watch this when I'm not live, if you ask a question in the comments, it'll notify me and I will get tagged on that and then I will answer your question. So hope you guys enjoyed it. And when I do this class, I do this as a class every week for my patients. So when someone has an x-ray, I have them come to this class so that they learn how to read their x-ray and what's normal and not normal. And then, so if you come in, I'll have you come to that class live. And then at the end of the class, privately, you see your x-rays and you can see it and you'll know what normal looks like, and there'll be normal and there'll be your x-ray. Say, I know what's wrong with me. I see what's wrong with me. When you see and understand what's wrong, you will see and understand how you can get better and how you can have amazing health and how you can have an amazing life, because that's what it's about. It's about serving. It's about having an amazing life. It's about feeling great almost all the time and having a ton of energy and doing what you want to do, right? Do whatever your purpose is on this earth. You can't fulfill it when you're sick, when you're in pain, when you have a headache, when you can't sleep. You can't fulfill that purpose. It's harder, right? We get focused on our pain and our problems, and we don't get we get focused inward instead of outward. Who can we serve, and what can we do for God, or what can we do for people? All right, guys. There's no other questions. I think that's it. But if you're watching this and I'm not live anymore, then please ask me questions. And thank you for listening. Thank you for your time. And God bless you.